Trump's plans to solve the looming Medicare crisis. Hi, I'm Trip Jordan, founder of Medicare for Her and owner of Jordan Retirement Solutions. Now that Donald Trump is the new president-elect, if you're over the age of 65, your next question is likely, how will his presidency impact me and my health care? As a senior and boomer himself, most are hopeful that he will have a vested interest in providing the much-needed answers to their growing concerns about the shaky Medicare and Social Security programs. Medicare is the federal health insurance program for 57 million people ages 65 and over and people with certain permanent disabilities. It helps to pay for hospital and doctor visits, prescription drugs, and other care services. However, there is an impending budget crisis for this program that needs to be addressed sooner than later. This is mainly in part due to the fact that for the next 20 years, an average of 10,000 people each day will reach age 65, with Medicare enrollment projecting to reach 64 million people by 2020 and 80 million people by 2030. Add to that nearly half of beneficiaries have 3 or more chronic conditions, relying heavily on Medicare to afford essential medical services. Even more important to note is the fact that 48% of the elderly population is considered economically vulnerable, with incomes less than twice the federal poverty line. So suffice it to say, Medicare is heavily relied upon by our greatest generation. So here's where it gets dicey though. Last year, in 2015, Medicare accounted for 15% of the federal budget, totaling $540 billion. And America's financial obligations to Social Security and Medicare are set to roughly double in the next 8 years. Americans are aging at such a rapid pace, there's not enough people overall paying into the system to offset the growing number of retirees expected to start collecting their benefits over the coming years. Although Medicare has about $200 billion in reserves right now, the program is expected to run at a deficit starting in 2021 and is forecast to be depleted by 2028, which will affect Medicare Part A, which helps pay for hospital stays, home health services, skilled nursing, and hospice. Since the trust fund that pays for Parts B and D is financed through beneficiary premiums and general revenues, not payroll taxes, these parts have been predicted to remain much more stable. Aware of this looming shortage, many Republicans have been trying to offset this surge by gutting Medicare with a possible goal of phasing it out altogether. And Paul Ryan of the House is at the forefront of this proposed reform. This past summer at the Republican National Convention, the GOP's platform included big cuts for Medicare and Social Security. For Medicare, the 2016 GOP platform proposed increasing the age of eligibility and an eventual replacement of Medicare with a contribution to a health plan of the beneficiary's choice. This could lead to huge jumps in premiums for seniors and limited Social Security benefits. Trump is rejecting any and all ideas of gradually converting Medicare to a voucher system in which the government subsidizes private insurance for future retirees. Opposing these changes, he said, "We're not going to cut your Social Security and we're not cutting your Medicare," he assured. Trump has vowed throughout his campaign to leave Social Security and Medicare untouched. Social Security and Medicare are both insolvent in 2034. So if you don't want to touch them, they'll be insolvent, said Republican Dave Bratt in response to Trump's stance. We're going to save Social Security, Trump reassured campaign supporters at a campaign rally in Iowa back in late 2015. We're not going to raise the age, and we're not going to do all the things that everyone else is talking about doing. They're all talking about doing it, and you don't have to. We're going to bring our jobs back. We're going to make our economy incredible again. You see, Medicare is funded primarily by three sources: general revenues, payroll taxes, and beneficiary premiums. And Trump has insisted that economic growth and cutting the tremendous waste, fraud, and abuse in the system would solve entitlement spending issues. He cited a recent news report stating that Social Security records show 6.5 million people in the U.S. being over 112 years old, when as of last fall, there were only 42 people known to be that old in the entire world. With no death records for these people, there is no one monitoring who's possibly collecting benefits illegitimately. Getting a handle on this is just a small part of what he plans to take care of. Trump's tax plan is intended to grow the economy significantly, resulting in more tax revenue flowing into Medicare, while simultaneously cutting massive costs by starting to negotiate our prescription drug cost. We're the largest drug buyer in the world. We don't negotiate. We don't negotiate. This is what he's saying. You pay practically the same for the country as if you go into a drugstore and buy the drugs. If we negotiated the price of drugs, Joe, we'd save $300 billion a year, Trump said to an MSNBC interviewer last February. The drug industry claims it gives us significant discounts, but the U.S. still pays far more for the top drugs than any other countries, frequently documented as paying more than double when an analysis of the most popular drugs and their costs internationally were evaluated. One of these drugs in particular that cost the U.S. double what other countries paid was documented as costing Medicare $2 billion in just one calendar year. Taking that into consideration, you'll start to see how this overpayment by our country adds up and is playing a serious role in the deficits that we're referencing. We are not allowed to negotiate drug prices. Can you believe it? We pay about $300 billion more than we're supposed to, than if we just negotiated the price. So there's $300 billion on day one that we solve, Donald Trump said at a rally at Plymouth State University in New Hampshire on February 7th, 2016. The industry claims its pricing is set based on a country's economic and health backgrounds, but negotiations with most governments are confidential. However, if our price benchmark is based on our economy, it's interesting to note that the drug Lantus, a long-acting insulin, still costs a whopping 30% more in the U.S. than in China, the second most expensive country. Negotiating these overinflated prescription drug prices down is something Trump plans on doing on day one. As you can see, like him or hate him, Mr. Trump is on a mission to keep Medicare and Social Security the way that it is, without imposing the significant changes to it that others are proposing. He believes that the imminent shortages can be solved by smarter, more efficient actions, and throughout his campaign showed a strong commitment to saving these programs without making cuts. Mark my words, he said in front of a packed arena of 7,500 people in Valdosta, Georgia, regarding his promises for Medicare and Social Security. We are marking them, Mr. Trump, and downright praying that you make the positive change to these programs that you're assuring, because 57 million people and counting are desperately banking on it.